So you're expecting a baby. It's an amazing time. And you've probably gotten a ton of advice on what to eat, how to sleep, and what to expect. But what about your teeth? It's a topic that's just filled with myths and some really important truths that affect both you and your little one. So today, we're going to get to the facts. Okay, let's just jump right into the biggest old wives' tale of them all, right? The one you've definitely heard. Does pregnancy mean you have to sacrifice your own teeth for your baby's bones? The answer is a big, fat, resounding no. Let's just put that myth to rest right here, right now. Your baby does not suck the calcium out of your teeth, and you are not doomed to lose a tooth for every child you have. So, if that's not what's happening, what is? Well, that's what we're going to break down. Here's our game plan. We'll bust those myths, pinpoint the real culprits, see how your health impacts your baby, go through a dental care playbook, look at what a healthy start for your baby looks like, and then wrap it all up with the big takeaway. All right, first things first. Let's officially clear the air and separate what's real from what's just folklore. So you can see the myth right there on one side, and then there's the reality on the other. Your mouth goes through so many changes during pregnancy, but guess what? Your baby isn't the culprit. The real reasons are the circumstances of pregnancy itself. Massive hormonal shifts, changes in your cravings, and even things like acid reflux. Okay, so if the bad guys are really hormones and all those lifestyle shifts, let's get a closer look. What are these real culprits actually doing to your teeth and gums? This right here, this is the most common thing you might run into. Think of it like this. Your body is flooded with extra hormones like progesterone and estrogen. These hormones don't create new problems, but they basically turn up the volume on how your gums react to the normal plaque that's already there. They just become way more sensitive and inflamed. So what does that turned up volume actually feel like? Well, these are the signs you want to watch out for. If your gums are bleeding when you brush, if they feel swollen, or if you've got bad breath that just won't quit, that could be your body telling you that pregnancy gingivitis is setting in. And then there's the other major player, tooth erosion. And this one is tied directly to those, well, less glamorous parts of pregnancy, right? The strong stomach acid from morning sickness or heartburn can come into contact with your teeth, and over time, that acid can wear away the protective enamel, making your teeth more sensitive and vulnerable to cavities. Okay, so we get the problems. Gums are sensitive, enamel is at risk. But this is where the whole story gets so much bigger. Because listen, this isn't just about your mouth anymore. It has a direct, and I mean direct, impact on your baby. And don't just take my word for it. This quote from the Tooth Files is, honestly, it's a wake-up call. Studies have drawn a clear line connecting gum disease in expecting moms to some pretty serious pregnancy complications. So taking care of your gums, that's part of taking care of your pregnancy. Full stop. And it doesn't even stop there. The bacteria in your mouth, the ones that cause cavities, yeah, they can actually be passed on to your baby. So when you keep your own mouth healthy, you're literally giving them a head start on their own dental health. It's like their very first line of defense. I know, this might sound a little overwhelming, but the good news is there's a really clear playbook for all of this. Let's walk through the exact strategies that are totally safe and super effective for these 9 months. First up, you gotta know that timing is everything. Dentists see pregnancy in 3 different stages. That first trimester, it's all about critical development, so we postpone anything that isn't an emergency. The third trimester, it's all about keeping you comfortable, which makes that second trimester from about week 13 to 21 the sweet spot. It's the golden window for getting most dental work done. And this chart really breaks it down for you. You'll notice emergencies and cleanings, totally fine, anytime. But the bigger stuff, like fillings, yeah, we're aiming for that second trimester sweet spot. And what about x-rays? Look, only if it's absolutely 100% necessary, and always with a protective lead apron to keep both of you totally safe. Okay, now for that tooth erosion problem. If you're dealing with morning sickness, here is a super important tip. Your gut instinct might be to grab your toothbrush right after, but don't. All you're doing is grinding that harsh stomach acid right into your enamel. Instead, swish with this simple baking soda and water mix first. It neutralizes the acid, and then you can brush. Here's a really fascinating little detail for when you're late in your pregnancy. You can't just lie flat on your back in the dentist's chair. Why? Well, the baby's weight can press on a huge vein, and it can make you feel dizzy or faint. The fix is so simple, though. Just lie on your left side with a little pillow propping up your right hip. A tiny change that makes a huge difference. You know, everything we've talked about is also about setting your child up for success long before that first tooth ever pops through. We're talking about building a foundation for their entire future health. It all starts with your diet, of course. Those are the essential building blocks for your baby's developing bones and teeth. But here's something you might not have considered. If your local water doesn't have fluoride, your doctor might suggest a fluoride supplement to help strengthen the teeth that are already forming in the womb. But the golden rule, always talk to your obstetrician before starting anything new. And that foundation goes way beyond just birth. Things like how a child breathes, through their nose or their mouth, or even where their tongue rests, can literally shape how their face and jaw grow. Catching something like mouth breathing early on can guide their development and maybe even help you dodge a ton of orthodontist bills or sleep issues down the road.
All right, let's bring it all home. When you boil all of this down, what's the one single idea you absolutely need to remember?
It really just comes down to this number, 2. Every single time you brush, every time you floss, every time you see your dentist while you're pregnant, you're not just taking care of one person. Your oral health is a protective shield for 2 people, you and the little one you're waiting to meet. So, as we finish up, I'll leave you with this final thought. Knowing just how deeply your health and their future are connected, what's the first simple step you'll take to make sure you have a healthy smile for both of you?